Today is all about hip replacements.
When discussing hip replacements, it's important to first understand the anatomy that will be replaced when you're doing a hip replacement. Looking at this model here, you can see that the pelvis, which is the large part here, meets the femur bone right here, where the head of that femur bone goes into the socket. With arthritis, you develop narrowing of the space between that ball and this socket. Secondary to that, you get hard bone along the socket. Sometimes you get cyst in the head of the femur bone, and then you also will get loss of the labrum along the outside here and loss of the cartilage along both the femur and the acetabulum. This leads to a more stiff and more painful hip as the arthritis gets worse. Now, because that arthritis affects the ball and the socket, to do a hip replacement, we need to get rid of the areas of arthritis. This requires a cut in the neck of this femur bone to remove the ball, and then within that socket we take the arthritis and remaining cartilage out of the socket so that we can prepare the bone for our hip replacement. Once the head and part of the neck of the femur bone have been removed, we are then left with the opening of the femur bone with a canal down the center. This area is prepped with special instrumentation so that we can specifically get the right size and fit to your bone. The parts that remain are the bony part on the outside of your hip, the greater trochanter, where all the muscles attach, and the lesser trochanter, where your hip flexors attach. After we've prepared the bone to fit your bone specifically, we then take the implant, which with their current iterations are typically a metal alloy that has a coating to encourage bone growth into the implant, with an area on the top where the new ball of the hip can be attached. This will slide into the canal of the femur bone and will get an initial fit into your bone, and then over the next several months your bone will then grow into the implant. And from the top view, this is what that would look like. Next, we will prepare your socket, and the way that typically works is we will remove the arthritis and any remaining cartilage out of your socket, which provides us with a smooth surface with bleeding bone in order to then fit a metal socket into place that has a coating on the back of it that allows for your bone to grow into this. Now this will fit right into the socket like that. Within that metal socket is a strong polyethylene plastic that will fit into there and will be the new cushion of your hip. Now the final piece of the puzzle will be taking the femur, adding a ball that is typically made out of a ceramic, and then putting that into your socket. And that's how the new hip moves now without bones touching each other, and how we get rid of the pain from the arthritis. Another very common question I get is, what is the difference in a partial and a total hip replacement? In both of those surgeries, we will replace the area of the femur, the head of the femur and the neck of the femur, and have a stem that goes down into the canal of the femur. Occasionally, with a partial hip replacement, we will use a version of this stem where it is cemented into your bone, but sometimes we do the normal one where your bone actually grows into the implant. Now, with a partial hip replacement, you don't actually have this metal socket like you would in a total hip replacement. The soft tissues around the hip and the cartilage within the hip remains intact. And from there, we're able to actually put a plastic piece on the ball of the femur, which then rolls around within your socket. This is typically reserved for patients that have had a fall and a fracture of their femur, but also have no pre-existing arthritis. In anyone that has pre-existing arthritis or is pretty functionally active, we would err towards doing a total hip replacement in that scenario. Another very common question that I get is, how long can I expect my total hip and my total knee replacement to last? With our current implants, we expect the lifespan to be on the realm of 25 to 30 years routinely. These changes have come as the plastics that we use are much more durable and have a much lower wear rate. This allows for better longevity without issues relating to the plastic wearing out or loosening of the implant over time. Our current iteration of implants are just now reaching that stage where they were in the 20+ year category, so more data will come out as these implants reach that long-term follow-up.
Thanks for watching. If you think of any other questions, feel free to reach out and we can talk about these topics in more detail.